Assalamualaikum Sir Rizal. I am Nur Anis Athirah binti Abdul Aziz from C14. Would to talk about my individual assignment. That is a journal reflection. My metric number is 35 and I'm from KPGC Penang. Okay. What is the outline on the journal is first is about introduction of COVID-19 pandemic. As we know, COVID-19 is called from the coronavirus, and the coronavirus is a large family of viruses that are known to cause illness, ranging from the common cold to more severe diseases such as Middle East respiratory syndrome and severe acute respiratory syndrome. A novel coronavirus was identified in 2019 in Wuhan, China. This is a new coronavirus that has not been previously identified in human. The cause provides a general introduction to the COVID-19 and emerging respiratory virus and is intended for a public health professional, incident manager, and the personnel working for the United Nations, international organization, and also the NGO. Okay, what actually happened? Okay, most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. However, some will become seriously ill and require medical attention. The virus can spread from an infected person, mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. These particles range from the larger respiratory droplet to the smaller aerosol. You can be infected by breathing in the virus if you are near someone who has a COVID-19 or by touching a contaminated surface and then touch your eyes, nose, or mouth. The virus spread more easily indoors and in the crowded setting. Okay, what was its impact to the country? The impact of the COVID-19 on Malaysia economy can be seen via high employment rate and depreciation in Malaysian ringgit against USD. In 2019, the employment rate of Malaysia is 3.3%, which means there are 5 and 200 individual employment. The COVID-19 pandemic has seriously impact to the Malaysian economy. But from a personally impact of COVID-19 is a very serious. People will losing their job. The pandemic and the measure to prevent its spread are driving a disproportionate increase in women and men employment and also decreasing their overall working time. For the domestic worker, the pandemic has meant no job and no employment benefit or other protection. People who work at the office, they continue to work from home and earn their salary regularly, but domestic workers cannot. Domestic workers should also be entitled to a salary during time of crisis. Some of them didn't receive the salary. And we also have to spend more time at home than outside if there is not important things to do. Okay, what I did learn from the experience. First, the people should washing hand to save life. The infection of other can be prevented or controlled by measures like hygiene, selective quarantine, wearing mask in public, and social distancing. All those who get infected develop antibodies. We don't know for how long or to what extent antibodies protect people from future novel coronavirus infection. Mental health also must be a key focus. Fear of the virus, lockdown, financial worries, and distraction from the further shutdown have brought on and or exacerbate anxiety and depression, supreme concern about the secondary pandemic. Okay, what the country and I decide to do? First, educate the public about the coronavirus. Second, provided the latest information on the development of coronavirus in and outside of the country. Third, provide facilities to deal with outbreaks such as laboratory infrastructure for testing the virus as well as facilities for screening at airport and border of the neighboring countries. The country also control the inflow and outflow of the tourists from the country into and out of the country. Tighten the standard operation procedure or we call as a SOP by wearing a face mask, bring sanitizer, and people need to take 2 doses of COVID-19 vaccine. We also do a lockdown when the cases of virus increases, and I as a citizen will always abide by government laws by complying with SOP, take care of health and hygiene by wearing sanitizer when doing activity outside of the house, and always focus on the surrounding situation. Okay, what is the conclusion is the COVID-19 pandemic outbreak continue to have a strong impact on the economy, trade and tourism industry. to date, there is no specific treatment for COVID-19, and worldwide many clinical trials are being carried out to find medicine and vaccine for COVID-19. Lastly, I would like to thank especially for Datuk Dr. Nur Hisham Abdullah, who is the Director General of Health Malaysia and the frontliner in responding to the pandemic COVID-19 outbreak. Thank you, sir.